as individual plans under the ACA's health insurance marketplace. Ken oversees a team of over 600 employees serving over 425,000 members in all facets of managed care, member services, claims, network, and clinical management, information systems, marketing, and regulatory affairs. He must be busy. He's a proud native of Belleville, Texas, wherever that is. Ken is a graduate of Rice University with a bachelor's degree in anthropology, economics, and managerial studies. He also holds a law degree from the University of Houston Law Center. Come on, put your hands together and let's welcome Ken as our speaker today. Thank you so very much, my brother. You need that?
All right.
And this?
Just give me a second to get organized here. I caught that. I may be getting old, but my reflexes are still pretty good. They did warn me that the clicker may not work too well, and I can't stand behind a podium, so I will wander around a little bit. But thank you all very much for inviting me to be here today. It's especially great to be here on a day when we're recognizing and honoring so many people involved in healthcare. And you know, everybody who's involved in healthcare, whether or not you work for an insurance company like me, or you're a physician like Dr. Munoz, or work for HCA and Kingwood Medical Center, or the Memorial Hermann System, or pharmacies, all the rest. You know, all of us really care about the patients that we serve, in our case, the members that we serve. And, you know, I've been a lifelong Republican, and back in the days when it used to be okay to be a compassionate conservative. Do any of you remember a compassionate conservative? You know, and that has become a little bit more challenging these days. But I will tell you that, you know, I'm going to talk a little bit about the Affordable Care Act and what's going on there, but and I know it's controversial to lots of people, and people don't like the ACA and stuff, but I think we need to have a balanced approach to thinking about these things. The other thing I need you all to know is that I've done this my entire adult life. I graduated from college in 1977 and went to work for the Prudential Insurance Company. Some of you may be old enough to remember PruCare. When PruCare was around, I was one of those PruCare guys, and I was a corporate gypsy for Prudential and went from Houston to Memphis, Tennessee to the lovely Newark, New Jersey area in the corporate office, and in Philadelphia and back to Houston. Then when Prudential sold their healthcare business to Aetna, I was with Aetna, and then I was with Humana. And one of the things that happened to me when I was with Humana is I started to see uninsured people. And you guys remember the movie The Sixth Sense with the kid that said, "I see dead people"? You know, I started to see uninsured people because I was in charge of the Houston market for Humana, and there were lots of people who were uninsured, and I said, let's go sell them insurance. And the corporate office for Humana said, no, let's not, because those people we might lose money on. What we want to do instead is find people who have insurance right now and convince them to switch to us. And I started thinking about, well, who are those uninsured people? And those uninsured people are not the guy begging for money on the side of the highway. He's probably uninsured, but they're waiters and waitresses in our restaurants. They're construction workers. They're people that work part-time to clean our office buildings at night. And so I've developed this real kind of compassion for how do we cover more people. And the reason we need to do that is because coverage is the key to access to health care in the United States. I just realized that this is about us. We've already sort of said that. We're a nonprofit health insurance organization that was actually formed by the Harris County Hospital System, even though we run independently of them. But I like the nonprofit model because whenever we have surplus, it doesn't go to shareholders in New Jersey or anywhere else. It actually stays in the community, and we use that money to expand access to care for people. We only operate in 20 counties, so it's a lot of fun to be part of an insurance company that's taking on the big guys that I used to work for. It really is. We are the corporate office. And almost all of us that are managing Community Health Choice used to work for some of the big guys, and we're trying to figure out how to beat them at their own game. So those of you who are in small businesses taking on the big national competitors, you know what we're thinking about. This is just how to think about health insurance. As I said, I think everybody should have health insurance. And I don't know, do I have a little point? Oh, I need to go back. Oh, man. Can you go back to that one for me? Yeah, okay. I'll try to only point here. But, you know, right now, if you think about people in terms of how much they make, this is the federal poverty level. This is the poorest, youngest person out there, and the income goes this way, and this is newborns over to age 65, right? And so I always have to start with this slide because I always forget, living this every day, how many people forget how it all works, right? So basically, if you're young and poor, you probably have Medicaid, right? Over half of the kids in the United States, no, in Texas, not the United States, but in Texas, more than half of the kids get coverage through Medicaid. And the CHIP program sort of sits on top of that for people that make a little bit too much money to be eligible for Medicaid, but for their kids. Over 50% of all the deliveries in the Houston area are paid for by Medicaid. Community Health Choice, even though most of you probably have never heard of us before, is actually the largest financier of prenatal care, maternity care, and NICU care in the Houston area. Over 25,000 deliveries every year that we finance. About a quarter of all the deliveries in Houston are financed through us in the Medicaid program in Texas. So when you think Medicaid's not important, yikes, it is, okay? But then you also have people here that are too poor for subsidies under the Affordable Care Act, but since Texas didn't expand Medicaid, these are people, a lot of these people have jobs. More than half of them have jobs, but they work part-time. They make less than $12,000 a year, and therefore they're not eligible for subsidies, but Texas didn't expand Medicaid. So these are the people that frankly go to the charity clinics. I'm on the board of 2 charity clinics in my spare time, Christ Clinic out in Katy, and San Jose Clinic in Midtown. We were started by the Harris County Hospital District. Those clinics and those hospitals, Ben Taub Hospital, LBJ Hospital, the Squatty Lions Clinic up here in Humble, all are part of the Harris County Hospital District system that see people who are also uninsured. And I spend a lot of my time trying to figure out how to make up insurance products for those people. But then the people out here are the people that get subsidies under the Affordable Care Act. And then here's the people that are over age 65, doesn't matter what your income level is, you get Medicare, but then there's this part of it which is long-term care, nursing home people. We have nursing home people in the audience. You know, something like 2/3 of the patients in nursing homes in Texas are actually covered by Medicaid. And so there's lots of when you think about safety net health plans and Medicaid and all, you tend to think about those are poor, undeserving people, right? That you just get a job. And sometimes I have to admit, I feel that way too. I just want to kick them in the butt and say, come on, get with the program. But when you start looking at it in detail, you realize that between these disabled folks here and the long-term care folks, and frankly, a bunch of babies and kids that can't do anything about their plight, you know, we have what I feel is a social obligation to make sure those people have coverage. And that's why I think the Medicaid program is really important. Now, those of us who work in the Medicaid program say it's really important that we save money in the Medicaid program and we provide that care as efficiently as possible and that we don't waste money in it, but we need that program as part of our safety net. Now I got to the point where I skipped over all these slides and why coverage matters, right? I bet you all of you have 3 things with you today. One thing is you probably have a cell phone, right? And you have a driver's license and you have a card for your insurance, right? This one happens to be blank, but it's one of our ID cards, right? Because we carry with us all the time because it's important for 2 really important things. One is access to care is dependent on you having insurance. It's really hard to get access to care if you don't have insurance. And the second thing is if you have any assets at all, it provides catastrophic protection against your assets being lost. So here's a quick story. A member of our health plan lives out here in the Kingwood area, and he was in his 40s, and he didn't need insurance. He's healthy, he's doing well. He left his employer where he had employer-sponsored insurance, and he decided, I don't need insurance right now. I'll get that later when I'm old and sick and all the rest. And boom, he had heart disease and spent $150,000 last year and totally depleted his money that he had in an IRA and a 401k plan. He has no money left for retirement now. He joined our plan January 1st and said, I never understood how important insurance was till this happened to me. So every one of us, in my view, needs to have insurance. And we need to, frankly, in most cases, be accountable for paying for it ourselves. And so why this is important is because one of the big things that they're trying to do in Washington right now is repeal the individual mandate. Sorry, I'm taking medicine for allergies and stuff, and it dries out my throat. So we're trying to say we don't like the fact that there's this individual mandate in the ACA. We don't like being forced to buy anything, and we should not be forced to buy insurance. And yet, those of us who spent their life in the insurance business sort of know that you can't wait and try to buy car insurance till after you had a wreck, right? You can't buy homeowners insurance after your house is on fire. You know, I have paid, I don't know how many tens and thousands of dollars that I've paid for homeowners insurance over the last 35 years and never had one claim. I've never had a homeowner's claim, right? My house never burned down. I'd never had hail damage and those kind of things, right? But yet I still see a need for that, primarily because my mortgage company won't let me have my mortgage without it, right? Right, and in Texas we have a law that says if you have a driver's license, you have to have insurance on your car. But heaven forbid that we would have a system that says you have to pay for your own medical care or have insurance to do it, right? We have a law in the United States, it's called EMTALA. Those of you who work for hospitals know all about EMTALA. In 1985, maybe, a Republican Congress with a Republican president, Ronald Reagan, said, we will not let you die on the street. If you live in the United States, we will treat you, despite your ability to pay, in the emergency room of the hospital. And of course, I think most of us know the most expensive place to get care is in the emergency room of the hospital, right? We won't give you preventive care services. We won't pay for you when you're just a little bit sick. But when you're finally so sick that it is an emergency that you have to be seen right now, then as a society, we'll pay for your care. So no matter what you think about the individual mandate and all that kind of stuff, I think I'll look across the whole room and say, I don't want to have to pay for any of your care. Sorry, I'll take care of my family and the rest, and you should take care of yourself. And that's really what the mandate is about. If you don't like that version of it, then the other version of it that you should like is there is no individual mandate. There's simply a choice that you get to make each year, and that choice is that you can either buy insurance or you can pay 2.5% of your salary to the federal government in taxes, and they'll use that to pay the hospitals in a very complicated, weird way, which I can't get into today. But essentially, the hospitals get some uncompensated care dollars, and that's how we'll pay for the care that you didn't pay for yourself. So I hate to, like I said, the idea of an individual mandate bothers me a whole lot, but I don't know how to get around it because in the insurance business, as I said, you can't wait till after you're sick to buy insurance. Unfortunately, some of the things being proposed, I'm obviously going the wrong way now. How about this way? So you can't see it real closely here, but this is since the ACA started in 2014, this is what the uninsured rate is by age, okay? Most kids covered by Medicaid, not really a big uninsured problem there. Clearly not a big problem with people over age 65, right, because they're on Medicare. But out here, especially those young invincibles like my kids, that at least are out of college and they're off my policy now, they're got their own problems, right? Actually, they're both insured, good. One of them works for a school district, got insurance through that, another one works for a big oil company, so they're okay. But the uninsured rate has come down each year, 2014, 2015, 2016. Really pretty dramatic decrease in uninsured. So as much as we don't like the ACA, something very positive has happened. And what that's positive is that's tens of millions of dollars that have come to pay for care with federal subsidies through, and that money goes into the Texas economy. That's why it's so important. Oh, here's another great slide that you all should know. If you look at the uninsured rates have decreased in every state. right? From here down here is the state average. Massachusetts, the best, the fewest uninsured people, and the other statistically significant outlier is the state of Texas. We have more uninsured people and the highest percentage of any state. And I think that's wrong and that's awful and we ought to fix it. I see uninsured people and say everybody needs to have insurance. And even though it's improved, it hasn't improved as much as other states. So the ACA has actually been really good for Texas. Billions of dollars have come to Texas. 1 million uninsured people now have insurance that didn't have it before. Very positive impact on the hospitals and doctors, and frankly, it has been great for our business. The reason why we have over 650 employees now is primarily because of the ACA. And it's okay that it's good for my business because we're doing good things for our members. But even though it might have been good for patients and good for insurers and providers, for most employers, it was bad, right? And, you know, these transitions are tough when my clicker doesn't work good. You know, small employers, because they shifted to community ratings rather than the ratings based on the age and health status of your employees, many small employers have had their rates really go up. The tax incentives were complex and not very helpful, and the SHOP that was part of the ACA didn't work, okay? That's the Small Employer Health Options Plan. For large employers, the ACA required people to have mandated additional benefits, no deductibles, no coinsurance for preventive care, had to cover dependents up to age 26. Well, that all cost employers money, and more employees now took up insurance. You know, employers used to save some money because some of their employees didn't take the employer-sponsored plan, right? And so now more employees take it because they don't want to pay the tax penalty. So it's cost large employers money, and there's all this complex regulatory. I'm just really bad at this, and okay. You know, really bad tax implications for the Cadillac taxes, this weird thing called the family glitch, which I'll skip over. You know, lots of new rules, but no help on driving down costs, which is really what we ought to be talking about. So what's happening, right? Well, so, you know, since the election, President Trump said we're going to repeal and replace the ACA, insurance for everybody, much lower deductibles, great health care, leave people beautifully covered. Well, I have to tell you that that's not exactly what's happening in Washington right now. If you look at the detailed terms of what's called the American Health Care Act, which was passed by the House, and the Better Care Reconciliation Act, which was being attempted to be passed by the Senate, yes, it repealed the employer mandate and other taxes. I'm actually fine with repealing the employer mandate as long as there's still an individual mandate, right? It repealed the individual mandate and replaced it with two different things which kind of work but probably weren't far enough, which means you have to either pay a higher premium when you sign up or you have to have a waiting period in the Senate bill. So we have to have more discussions about how that would really work. They reduced APTCs as the subsidies that low-income people get to buy insurance. They reduced those. They said we're going to give the states more flexibility, and that's probably good to give the states more flexibility, but how that works in a state like Texas is always really kind of scary to us in the business. It phased out the Medicaid expansion, and so for those 31 states and over 70% of the population of the country that lives in those 31 states, this would be really bad because those states were counting on that Medicaid expansion. And probably the most significant thing is that they're talking about changing the way Medicaid is funded from a shared state-federal to the federal locking in a flat dollar amount per enrollee or locking in a flat dollar amount, period. And that should be really scary to a high-growth state like Texas where there's more and more low-income people. And so those changes in Medicaid are really very significant. And wait a minute, that wasn't even in the ACA. Traditional Medicaid just suddenly jumped on the table as part of the discussion about repealing and replacing the Affordable Care Act. But the bottom line is there's some good stuff in these things, but there's some really devastatingly bad things. So the Health Insurance Association, our nonprofit association, the AMA, the AHA, pretty much everybody in healthcare has been opposed to these bills. And so the question is, will this pass Congress? Well, we found out about 10 o'clock last night that it will not pass Congress. They've now said, several very conservative senators said, we won't vote for this because it's not conservative enough. So that's not going to happen. So what might happen? Oh, there's the process of being regulatory changes. It was actually designed as a three-step process. First, repeal the Affordable Care Act, do some regulatory changes, and then pass a new law that would change some other things. So, frankly, the regulatory changes have not helped much at all. You haven't heard much about those. And the new legislation to come, maybe they change essential health benefits. They're talking about now just doing a straight repeal and delay, which would be repeal all the financing mechanisms, repeal all the taxes, but leave the insurance changes in place. So as an insurance company, if you repealed and delayed, we'd still have to cover everybody with no pre-existing conditions, but there'd be no mandate anymore. I will tell you, if that happens, there will be no market for individual insurance in the United States. If the goal is to drive all of us out of business, that's the way to do it, because we will go into a death spiral of only people waiting to the last minute to buy insurance. So this is not good where we are in Washington right now. What we hope will happen instead is that the next slide will come up. What we really should be talking about is this, the healthcare triple aim. And so some of you on the hospital side know this very well, and this is what we live with at Community Health Choice every day. We have to simultaneously figure out how to improve the health of the people that we serve, improve their experience of insurance and care, and save money at the same time. And why aren't we talking about saving money in healthcare? So I'm a huge baseball fan, huge Astros fan. I can't believe they lost last night the way they lost. But here's what you all have to take away. This is the one point where you should write it down, okay? A healthcare home run. This is what we need to be talking in Congress about. First and foremost is health is a personal accountability issue. We all have to be personally accountable for our health and financing our own health care. Yes, we should help some low-income people, help them move out of poverty. Shouldn't expect that they're going to live a lifetime on Medicaid, but when you are down and out, we're not going to let you die in the street. But personal accountability is important. The second thing is everybody should be covered with a minimum of catastrophic coverage. It doesn't have to be a Cadillac plan, a fancy plan, but everybody should not, no one should go bankrupt because of health care. We should figure out a way to get everybody covered with a basic kind of plan. The third, and those of you again who are involved in healthcare know this, the administrative stuff that we have layered on by here's the Medicaid rules, here's the Medicare rules, here's the commercial insurance company rules, here's United Healthcare's rules, which are different than Aetna's rules, which are different than Community Health Choice's rules. We have to simplify the administration. And the fourth thing that we have to do is slow or stop the growth of medical care by finding those things where we can work and change the way that we compensate doctors and hospitals for the services they provide, and do that in a way that what we call pay for performance, but that actually is paying for value, not for more volume. Because what's driving us all crazy is that the United States costs so much more and we don't get that much better outcomes out of it. So that's what we should be talking about. So my crystal ball is there's been too much rhetoric on the Republican side for them to give up. They're going to continue to try to figure out something. But my guess is in the end, there's so much Republican ideas in the ACA. This is not Medicare for all or a single payer type bill, that something is going to be, it's going to have to be rebranded. It's going to have to think about how we talk about it differently. Yeah, there'll be some changes. My optimistic side of me sort of says that we'll find ways to simplify and streamline and do these things. But if the financing is not there, which the primary thing in both the AHCA and the BCRA is actually the big tax cuts that primarily benefit the big corporations and high-income people. And taking those tax dollars out means you can't subsidize Medicaid as much, you can't subsidize subsidies for people as much. So I worry that we're going to lose the gains in insured people. My pessimistic view, which is a new pessimistic view, is that they'll just repeal and delay any replacement rather than the BCA passing. But the problem is you have to keep marching. You know, as an insurance company, we have to say this is the law right now, and we have to move forward with the law as it is right now and do the best we can and try to stabilize the individual market at the same time that we're preparing for something new that we don't know. So it's a terrible time right now. I don't know, anywhere you are in healthcare right now, it's a problem, because how do you plan? How do you move forward? And all of you that are in businesses know that it's really hard to plan when you don't know what's happening next. And that lack of certainty from a federal and a state financing standpoint is very problematic. We don't really have time for questions and discussion, but I will hang around for a little bit afterwards, and glad to talk to any of you who see the world differently. But I do just have to say, I'll go back to my 4 bases. I give up this, but I really believe that I've talked to my incredibly conservative brother-in-law, to my bleeding heart liberal sister, and you know, there's an answer in here that we can all come out and live with. I really believe that if we work together in a bipartisan kind of way, that we can figure it out. Because the last thing that I love the Pledge of Allegiance, because we talk about one nation and we talk about liberty. And if you look, one of the other things that some of us still carry, I know most of you don't anymore, but some of us still carry coins, right? Most of you just have plastic, I know. But, you know, on the coin, on one side it says liberty, and on the other side it says e pluribus unum, from many one. And when it comes to health care, we have to do both. It's not either liberty or a community paid for through taxes. It's both at the same time. And we have to figure out as a country how to do both at the same time. Give people the liberty and the choices that they need, but at the same time, in the end, we are all better, we're all stronger if we work together as a community to make sure that all of us have the health care that we need, and I think financed in the way that we finance it now. So I will stop. I know I'm over my time. They've been giving me the hook back there for 5 minutes now, but as you can tell, I love talking about this stuff. So thank you all very much, and we'll see you.
Thank you, Ken. Come on, let's give Ken another hand there. We want to also give you a token of our appreciation from the Chamber of Commerce. Ken, we want to give you something. This is so exciting. And it's an executive from the Executive Gift Shop.
All right, thank you very much.
Yeah. So you're welcome. Thank you very much, Ken. He shared so much information. He shared so much information about the healthcare system and problem. I was thinking as he was talking, there's one thing that I know to do after hearing him, and that is to pray and ask God to give wisdom to our legislators to figure out what to do. Also on our money is in God we trust. Well, now we're going to do some presentations here as we get to our award. And our award sponsor is Harris County EMS, Jennifer Falk and Kelly Madlock with Harris County EMS. Please come forward as we get ready for these awards to hand them to our honorees. Thank you so much for coming forward here. And as I read the names, we're going to ask these finalists to come forward and receive their presentation. And the first one is Rosalie Conry. Rosalie Conry, come forward. She's ORN Kingwood Medical Center. Let me tell you about her. Rosalie Conry, RN, joined Kingwood Medical Center in 2010. She earned a bachelor's degree of science, Bachelor of Science degree in nursing from Lysicum University in the Philippines. In 2016, she was chosen as a Physician's Choice Award winner for Kingwood Medical Center. She also served as chairman of the Unit Practice Committee for the past 2 years. She considers her highest career achievement to date to being one of the group of nurses who started the shared governance for Kingwood Medical Center, as well as a participating member of the Heart team who started the Heart program for Kingwood Medical Center. Rosalie has a passion for less fortunate children, calling them her adopted children. She raises money throughout the year to fund school supplies, meals, and shoes for hundreds of children in the Philippines, making 2 trips per year to deliver those items. Come on, once again, give a hand to this year's finalist, Rosalie Conrad. Thank you so very much. Photos will be taken after we finish with all of our honorees today, so thank you very much. Our next finalist is, let me get the envelope, Anita Smith, outpatient nurse, Texas Children's Hospital, Specialty Care, Eagle Springs. Anita Smith, RN, began her nursing career at Texas Children's Hospital in 1997 as an LVN. She received her associate's degree in nursing at Lone Star College and will return to school this fall to complete her bachelor's degree. Throughout her nursing career, Anita has worked in many departments at Texas Children's Hospital, including the emergency room and main observation unit. She is certified in pediatric nursing and pediatric emergency care. Anita is a member of the Texas Nurses Association as well as the American Nurses Association. She considers her highest career achievement to date to be the ability to work and return to school successfully, as well as her participation in opening the otolaryngology department. Hello. For the Texas Children's Specialty Care at Eagle Springs. Was I in the ballpark a little bit since he was talking about first base, second base? Anita is married and has 1 daughter. She volunteers her time with the Girl Scouts, San Jacinto Council, serving as a troop leader, cookie mom, and fall product mom. She's also very active with the school PTA and her daughter's local swim team. Come on, give it up once again for Anita Smith. And again, Anita, right afterwards, everybody's going to come up for a group photo. Now I want to announce the 2017 Nurse of the Year. Congratulations to the 2017 Lake Houston Area Chamber of Commerce Nurse of the Year, Marcia Kalaman, Professor of Nursing, Lone Star College, Kingwood. Come on down. Marcy Carleman, MS-RN, CMS-RN, joined the LCS Kingwood in 2011. She earned an Associate of Applied Science and Nursing degree from Lone Star College Kingwood and a Bachelor's of Science degree and Nursing degree from the University of Texas Medical Branch. Additionally, she earned a Master's of Science in Nursing Education degree from Texas Woman's University. In 2012, Marcia earned the Texas Woman's University Perry Outstanding Master Student Award. She considers her highest career achievement to date to be earning her degree in